Hi, it's Carol Clark, your bariatric business boss, and today I want to ask you a question, and that is, what do you expect? Because what you expect is often what you're going to receive. So it's, what do you expect of yourself? What do you expect of your relationship with your spouse or significant other? What do you expect of your team? What do you expect of your business? How do you expect it to grow? Do you expect it to stagnate? Do you expect sales to go up? Do you expect to be disappointed? Those are the things that will often guide what actually happens in our life. Now, obviously, there's work involved in making what it is that we want to occur happen, but your expectations play a bigger role than what many people think in terms of what you end up receiving. So when you're at your practice, your expectations for your patients are something that will come to fruition. Here, I know we do sleeve gastrectomies, and my husband, Dr. Clark, does them as an outpatient. It's setting clear expectations. Our patients actually love it, and they expect to feel pretty good. They expect to have their upper GI. They expect to go home. They expect to be cared for. They expect what their first couple of weeks are going to be. They expect when they're going to be coming in. Setting those expectations and educating them about that makes a huge difference in terms of their outcome. The same is true for your staff. If you set clear expectations, they will rise to the occasion. And oftentimes, if you can just give them the outcome that you want, what you expect as the outcome, they can figure it out along the way and save you the trouble of having to dictate what needs to be done. When you're setting your goals for each quarter or each month, however it is that you do it in your practice, you don't want to just do it once for the whole year, but even if you're getting ready to have a big planning meeting for next year, since we're getting into the last quarter, depending on when you're watching this video, but it's being recorded just before the last quarter in 2019. But if you set expectations for your staff about what your sales are going to be, what your patient outcomes are going to be, what your staff, turnover, hopefully we really don't have much of a turnover here, fortunately, what your team is going to create. If you set those expectations very clearly and you determine those even with them involved in that whole process, you're going to find that you can set your expectations pretty darn high and have a very high chance of attaining that. So when you're thinking about your relationships, how you're guiding something with your children or your spouse, how you're interacting with your staff, your patients, what your expectations are for your business, that next meeting that you have, if in your mind you set the expectations that you truly want to occur, and I encourage you to think big here, you will find that you will have a much increased likelihood of having that come to fruition. It also drives our whole motivation, it drives our energy, and it really can have a big impact. So I encourage you to think about, what is it that you expect? Because oftentimes, whatever it is that you expect is what you're going to receive. So I encourage you to really think about that, implement it in your planning processes, implement it in your everyday interactions, and whenever you're going into a meeting, no matter what it is, set your expectation and be bold about it, be strong about it. And you will find that a lot of times, most of the time, at least I do, I find that that actually comes true. And it also helps boost your self-confidence, the confidence of your staff, the confidence of your patients in knowing that they've got this and that you've all got this. And I encourage you to use this in your everyday interactions, and especially when you're doing your planning for the next month, quarter, or year. I hope you found this helpful. If you need help with that, give me a shout out, Carol, K-A-R-O-L, at weightlosspracticebuilder.com. I have some very great tools that you can access as well on my website, weightlosspracticebuilder.com. And if you want to go in a little bit deeper and actually get one-on-one time with me, in addition to marketing plans and lots of different trainings and things that help you and your staff, go over to bariatricbusinessboss.com and join my membership. We have a great time in there. And I actually have an introductory rate there, so hop on over there and check it out. In the meantime, I hope you have a great day, that you've set high expectations for yourself and for your team and just for your business overall, and that you attain that today and every day in your business. So take care, everybody. Until next time, have a great day.